Greeting, my name is Champoyi and my matrix number is H17A0038. In this video, I will present about the process and application of promotion and health education based on an online mental health promotion program that conducted on 24 November 2020. First, I will introduce about the proceed model. It is a comprehensive structure for assessing health needs for designing, implementing, and evaluating health promotion and other public health programs to meet those needs. Proceed stands for predisposing, reinforcing, and enabling constructs in educational diagnosis and evaluation. Process stands for policy, regulatory, and organizational construct in educational and environmental development. Now, I will introduce about how we use the 9 phases of Proceed and Proceed model. In phase 1, social diagnosis, we ask the community what it wants and needs to improve its quality of life. In phase 2, epidemiological diagnosis, we identify the health or other issue that most clearly influence the outcome and the community seeks. In phase 3, behavioral and environmental diagnosis, we identify the behaviors and lifestyle and environmental factor that must be charged to affect the health or other issue identified in phase 2 and determine which of them are most likely to be chargeable. In phase 4, educational and organizational diagnosis, we identify the predisposing, enabling, and reinforcing factors that act as support for or barriers to changing the behaviors and environmental factors we identify in phase 3. In phase 5, administrative and policy diagnosis, we identify the internal administrative issue and internal external policy issue that can affect the successful conduct of the intervention. Though an administrative and policy concerns include generating the funding and other resources for the intervention. In phase 6, implementation, we carry out the intervention. In phase 7, process evaluation, we evaluate the process of the intervention. In phase 8, impact evaluation, we evaluate whether the intervention is having the intended impact on the behavioral and environmental factor is aimed at and adjust accordingly. In phase 9, outcome evaluation, we evaluate whether the intervention's effects are in turn producing the outcome the community identified in phase 1 and adjust accordingly. For the phases that conducted in this online mental health promotion program are phase 1, social diagnosis, phase 6, implementation, and phase 7, 8, and 9, which is evaluation. Before this online mental health promotion program conducted, students have done a survey on stress, anxiety, and depression. The method and strategy of the intervention is in form of a virtual speech that given by Dr. Muhammad Afifuddin bin Muhammad. After the program has done, students were required to fill out a feedback by using Google Form, and the feedback is to determine the effect of this program to students. From this program, we know that the most difficult stage of life is between the age of 15 and 20 years old. when individuals find their identity and some of them may face mental illness. This abusive approach can influence someone to get depression because of some stereotypes that say people who like to be alone are typically insane. Depression symptoms are of no interest in some things, not trust, think more about negative things, suicide attempts, and others. We need, however, to help troubled individuals and try encourage them to clear their mind and take a deep breath. Besides that, symptoms of anxiety are overly concerned about tiny matter and crowd fear. However, it can be solved by learning from two individuals to more individuals. Bipolar disorder can result from anxiety, which can impair our job. Looking for a doctor who provides physiotherapy may be a good idea. According to the speech of Dr. Muhammad Afifuddin bin Muhammad, after marriage, someone can have personality changes due to stress, particularly financial changes. Therefore, engaging with partners is necessary, and enjoying doing what you want is also one of the solutions. Lastly, obsessive compulsive disease also have been mentioned in this program, a serious illness where a person is overly cautious due to fear of contamination, which causes him or her to spend about 4 hours in the bathroom. Last but not least, in my opinion, the recommendation for future online mental health promotion program is increase the focus and service offering for children and young people. Most of the trials that have been conducted up to this point have included only adults as participants. But actually, many mental disorders have their beginnings in childhood or adolescence. Early intervention enables children and young people to start treatment as soon as possible. When the symptoms of mental illness are not too disabling, and assist them to develop the skills that require moving forward to manage their illness and live in general. Therefore, early treatment is essential for this age group, and that the focus and service offered to children and young people must therefore be a key feature for any future program. This is all of my presentation. Thank you.